It is Westex Wednesday, and that means Dr. Beck is live in our studio this morning.
Good morning.
We're approaching October, which is Breast Cancer Awareness Month. So Dr. Beck is going to share with us about how we can take care of ourselves and take some measures to just be more aware about our bodies. Thank you.
Yeah, absolutely. Breast Cancer Awareness Month is coming in October, as you already mentioned, and it's important because breast cancer is one of the leading cancers in women. It's about the second leading cause or type of cancer in women. About 10 to 12% of women at one point in their life may get cancer, breast cancer. So screening is important. Just like almost any other disease or illness, early detection and prevention are the key. And so we usually recommend that women start doing self-breast exams in their 20s or 30s. I mean, it can happen. It's quite rare. Breast cancer is a disease that is much more common in women as they get older. Currently, the CDC recommends screening with yearly mammograms starting at the age of 50 up through 55, and then after that, it may be every other year. But the American College of Radiology actually recommends screening mammograms at the age of 40. So there's a little bit of discrepancy now. I'm not a breast cancer expert, but this is common knowledge and stuff that you can look up online as far as the information.
Very interesting.
As I mentioned before, the key here is early detection. And I know a lot of women are really scared about breast cancer. Sometimes there's something called denial. I don't know if you've ever heard that word.
Yeah.
But the treatments are so much better, and the cure rates are so much better if breast cancer is picked up early. A woman is going to know her body much better than if when they go in to see a healthcare provider or even with a mammogram. And if a woman notices a lump or a bump or any skin changes or nipple discharge that is out of the ordinary, they should certainly see a medical provider as soon as possible.
Right, and being aware of that is so important. I actually went to MCH last year because I wanted to get an exam done. They wouldn't do a certain exam on me that involved machine and radiation just because I'm not at that age yet.
Correct.
But what are some ways that younger women can make sure that they're still in good health?
Now, there are some blood tests out there that are more or less tumor markers. Some insurance companies will pay for them, some won't. But they can let women know if they have an increased risk of breast cancer. It's not that that's diagnostic. The other thing to understand that's important to understand is there are risk factors for breast cancer. If a woman gets older, that's an increased risk. Also, if there's a strong family history of breast cancer, then women need to understand that that puts them at increased risk of breast cancer. And what you're referring to, and sometimes the insurance companies don't want to pay for those studies if they're not necessarily indicated, but there are other less invasive tests. Ultrasound is another option. But the big thing is that it's hard to just order a screening diagnostic study unless there is a lump or a bump or something abnormal on a physical exam that would warrant ordering the diagnostic study that you were referring to.
That's good to know, because there is a risk for younger women as well, but you can examine yourself monthly and make sure everything is good. What's the risk for men? I know there's a small percentage of men that can get breast cancer.
Yeah, believe it or not, much less common in men than it is in women, of course. Most of the cancer, breast cancer in women evolves from or starts in the tissue that is milk producing. Since men don't have that, then it's still possible to get breast cancer in men, but much more rare.
That's some good news, but very important for women to take care of themselves as well. And you're never too young to kind of keep an eye out for things like that. I do have a family history. My grandmother actually had a form of breast cancer, and so I've been kind of making sure that I'm okay. But what else would you recommend as far as, not preventative measures, but ways that people can check to see if they have lumps or how often they should check?
And kind of like we'd mentioned earlier, the breast self-exam should be performed monthly, ideally about the same time of the month for the woman, because the hormonal changes that go along with menstrual cycles can affect breast tissue to a certain degree. That and women should have a yearly checkup with their OB-GYN doctor or their family primary care doctor, and usually part of that exam is going to be a breast exam. Now that might be once a year or every other year, so that's why it's so important for a woman to do the breast self-exams monthly.
Very good advice. And we do have the contact information for Westex Urgent Care. If you'd like to visit their Midland facility, go check them out. We have a number on your screen this morning. But again, thank you so much, Dr. Beck, for being in our studio. Very good advice. And you're so knowledgeable. We appreciate it.
Thank you.
We're going to take a quick commercial break, but we'll be back with some more news and weather for you coming up next.